So the South African Constitution, since the advent of our democracy, has enshrined and protected a right to health care for everyone in the country. However, the legacy of apartheid looms large over our country. We have what's called a tiered healthcare system, which means that the few people who are able to pay for it are actually using about 80% of the health spend we have in South Africa. So what we see is that for some people, healthcare and more is readily available and accessible at extremely high quality. But for a majority of our population, particularly those who rely on the public sector, they are struggling to get access to healthcare. However, in the last 20 years of our democracy, we've seen that people's quality of healthcare and their ability to access it has been gradually increasing it. We have the largest number of people on HIV treatment, and we've just had growing measures from government to improve the access and quality of healthcare for all. So I think South Africans' ability to understand their rights and entitlements to healthcare is complicated. When we had HIV denialism, we had a very high level of people understanding what their rights were. People were marching in the streets demanding their right to treatment, demanding their right to nevirapine. And so we saw very high levels of engagement from civil society and the public to ensure that their rights were realized. I think during the COVID pandemic, things have changed slightly, and that's a lot to do with the fact that a lot of the measures around COVID are non-pharmaceutical, and so people are struggling to understand what they should be doing in relation to healthcare, and also just how their actions impact everybody else's right to healthcare. Of course, we've had a lot of controversy around, for example, the National Health Insurance Bill, but at the end of the day, I think people understand that universal health care and universal health coverage are an integral part of realizing the right to health. And I think more and more people are demanding equality and equity in our healthcare system, and that's really important in our new democracy. There's quite a significant urban-rural divide in South Africa, and that's again a legacy of apartheid. So what we see is people in urban areas are given much better access to healthcare, and they're much more literate about their rights around healthcare and just health in general. Whereas in the rural areas, their ability to access healthcare and correspondingly their literacy around what they're entitled to is much lower. People have to drive hours and hours to get basic treatment in rural areas, and so I think the sort of schemes around improving primary healthcare, improving access to clinics in rural areas is an integral part of realizing the right to health now. But there is still a big divide. Most of the healthcare services that people need, especially in advanced healthcare, and a lot of the big hospitals are concentrated in urban areas. And I think that's something that we really need to address going forward to ensure that everybody in South Africa has a right to health that's realized. I think there's been a lot of controversy for the past few years about who's entitled to access healthcare in South Africa. Should it be only South African citizens? What about people in prisons? And our courts have taken a lot of time to think about who is entitled to these things. And there isn't any reason why anyone who lives in South Africa should be excluded from anything. So in other words, people should be entitled to access healthcare services irrespective of their socioeconomic status, their status as citizens or not, their status as incarcerated or not. In fact, during HIV and TB epidemics in South Africa, there was a lot of issues around prisoners accessing treatment, for example. And those same concerns have resurfaced when it comes to a COVID-19 vaccine. However, the state has duties to many different groups of people. For example, prisoners are wards of the state. They have a particular level of duty of care between the state and prisoners. That means that the state actually owes prisoners more. When it comes to foreign citizens, the South African Constitution specifically says that people should not be discriminated against on the basis of their origin or citizenship. And so really the only right that differentiates between people who live in South Africa and South African citizens is the right to vote. The right to vote is held only by South Africans. So it's very important to understand that anybody who lives within the boundary of South Africa is entitled to access healthcare. Now, how that has translated into policy has been complicated, and I think it's been further complicated by differing views and opinions in the public about who should be entitled to access healthcare services, particularly because we are a resource-constrained environment. However, the Constitution explicitly says under Section 9 that you cannot discriminate against somebody on the basis of their origin or their citizenship. So anybody who is in South Africa and physically living here should be entitled to access healthcare services. There's a public health imperative, I think particularly in the case of COVID and other epidemics, to ensure that anybody who needs access to healthcare services gets it. Because it's very, very difficult to control epidemics if you're excluding certain groups and certain populations from accessing those services that they so desperately need. So really, everybody who lives here is eligible to receive healthcare services, and our laws and policies should be reflecting that. So the issue of what recourse one has whenever one has difficulty accessing healthcare services is always a complicated question, because it's very specific to what your experience was. So for example, if you feel that your doctor was negligent and didn't give you the correct care, then your recourse is in medical malpractice lawsuits. But at the same time, there are ombuds, there are community commissions, and there are more broadly things like the South African Human Rights Commission. And all of these different bodies are tasked with ensuring that South Africans get the right to healthcare realized, that the quality of healthcare that they receive is up to standard. And so really, people who feel they have been wronged by the healthcare system or feel like their level of treatment was not sufficient, or even that they were turned away from certain types of treatment, should feel that they have a recourse within their own communities and more broadly within the infrastructure of things like the Human Rights Commission to take up those wrongdoings and ensure that they receive the care they're entitled to, and ensure that justice is done for any wrongdoing that may have happened against them. In terms of practical steps that you can follow, there is a healthcare ombud who's tasked with ensuring and addressing complaints. And realistically, any healthcare facility you go into should have very clearly marked signage that tells you where to go if the service that you received has been inadequate, or where you can lodge a complaint if you feel like a decision that was taken was incorrect. So really, these mechanisms are available to you, and if you have any issues, by approaching a member of staff or simply looking around your clinic, you'll be able to find out which body has jurisdiction over your particular complaint. You can also lodge a complaint directly with the hospital, and then, as I said, if there's been a serious violation of your human rights, then you should go to the Human Rights Commission, which they have offices in many different provinces, and they can hear and address your complaint. The alternative is the public protector if there's been some sort of government maladministration involved. And then finally, if the particular infringement or problem that you faced is specific to your gender, you can always approach the Commission on Gender Equality. And they, for example, last year exposed some issues around HIV positive women being sterilized in medical facilities. So if you do experience some type of negative environment or action from healthcare workers or healthcare providers, there are lots of avenues. You shouldn't feel like you are voiceless or powerless to rectify the wrongdoings if you experience any. So there's a big issue in South Africa around access to justice, and it is, as many things in South Africa are, often determined by one's wealth. However, the government has put into place a variety of different measures where you don't necessarily require a lawyer to be able to ensure that you receive justice. And that's through measures like Chapter 9 institutions such as the Public Protector or the Human Rights Commission, as well as local ombuds and community worker commissions that are based in very many healthcare systems and facilities. So in brief, there is a gap between people accessing services and ensuring that they have justice for wrongdoing, but there have been a lot of measures that are outside the legal system per se that people can use to ensure that they get justice for whatever wrongdoings they've experienced and that they're able to realize their rights. So don't think when you're experiencing something that your only recourse is a lawsuit against the person who wronged you. Justice may look slightly different for you depending on what kind of wrongdoing you experienced, and there are ways to get access to that sort of remedy or rectification without necessarily needing to hire a lawyer. So I think the COVID pandemic in particular exposed how important it is, not just for people who have COVID or experiencing communicable diseases, but broadly that people should be healthy. You know, for example, comorbidities like diabetes have led to severe COVID. And so there's sort of two things that happen when people have access to adequate healthcare. The one thing is that they can prevent disease. So, and that's a lot of the work that we do at Priceless, and I think in Advits in general, is we try and prevent disease. And that frees up healthcare capacity in our resource constrained setting to ensure that the people who really need it, the injuries and kind of healthcare issues that cannot be prevented, have the resources they need to deal with it. But there's also kind of a broader community interest at play when you ensure that people are healthy and have access to the healthcare they need. And it plays out in ensuring that a pandemic is controllable. It plays out in ensuring that people can realize the rest of their rights, so that people can live dignified lives. They can do the things they want to do. Because remember, when people are unwell, it has a knock-on effect. Often they cannot work, they cannot look after their children, they cannot earn a living. It leads to cases of poverty, it leads to a lack of access to food and other basic rights. So really, ensuring that people are healthy is sort of the baseline for ensuring that they can live the kinds of lives they want to live. It's why in the WHO Constitution, we don't talk about per se a right to just health. We talk about a right to the highest attainable standard of living, because there is an understanding that people's health is impacted by a number of different things, and that if you are unhealthy, you cannot fully realize the rest of your rights. So that's why it's really important for people to have access to health care and to ensure that their right to health more broadly is protected. It's not just about the hospitals and the nurses, it's about all the other things that make sure that you can live a healthy life. A right to adequate standard of living, a house, enough food, and all the other things that go with that to ensure that you as an individual can be healthy and live the life you want to live.